Dr. Liz Angelewski, and I'm the Director of Clinical Education and Training at Theralase. In this clinical education video, we will discuss lateral epicondylitis, often called tennis elbow, a painful condition of the elbow caused by overuse. The distal humerus has a medial humeral epicondyle and a lateral humeral epicondyle. The lateral epicondyle is the bony common origin for the wrist extensors. Pain and inflammation at the myotendinous junction of this muscle group is referred to as tennis elbow. Injury to the extensor carpi radialis brevis muscle and occasionally the extensor digitorum muscle constitutes lateral epicondylitis. The incidence of epicondylitis may approach 1 to 3% in the general population. In recreational tennis players, elbow injuries comprise approximately 20% of all injuries. Most people with tennis elbow are between the ages of 30 and 50. Although playing tennis or other racket sports can cause this condition, so can a number of other occupational and recreational activities that require repetitive and vigorous use of the forearm muscles. Lateral epicondylitis is often due to overuse and repetitive microtrauma to the extensor carpi radialis brevis muscle, leading to pain and inflammation. Smoking, obesity, increased age, repetitive movement, and forceful activity, managing physical loads over 20 kilograms, comprise the major risk factors for epicondylitis in the general population. Factors that correlate with a poorer prognosis include high physical strain at work, dominant side involvement, concomitant neck pain, duration of symptoms greater than 3 months, and severe pain at presentation. A number of factors, including poor stroke mechanics and inappropriate racket type, predispose tennis players to developing epicondylitis. Patients with lateral epicondylitis typically complain of lateral elbow pain that develops gradually over time. The pain can range in severity from having a minimal effect on sports or work activities to severely impairing basic daily tasks and sleep. Symptoms are usually exacerbated by repetitive movements of the wrist and elbow. Lateral epicondylitis is diagnosed clinically by the following findings: localized tenderness over the lateral epicondyle and proximal wrist extensors, pain with resisted wrist extension with the elbow in full extension, and pain with passive wrist flexion with the elbow in full extension. Pain can be further elicited with resisted wrist pronation or supination and grip strength testing, particularly when the elbow is in full extension. Over 90% of cases can be managed successfully with conservative treatment. Initial management of lateral epicondylitis consists of activity modifications, counterforce bracing, low-level laser therapy, and specific strengthening exercises. Patients should try to avoid activities that exacerbate symptoms and limit repetitive motion and forceful tasks. For athletes, correction of faulty biomechanics must be part of their activity modification. Counterforce braces may provide benefit during the first 6 weeks following injury by reducing tendon and muscle strain at the origin of the extensors. These braces are placed on the forearm approximately 6 to 10 centimeters distal to the elbow joint. Low-level laser therapy has been shown to be effective in reducing pain and inflammation. Persistent or worsening pain despite appropriate management often prompts imaging and additional therapies such as a cortisone injection. The Theralase TCL-2000 therapeutic laser is well indicated and very effective in treating lateral epicondylitis or tennis elbow. In a majority of cases, the pain and inflammation is reduced after the first few treatments, with subsequent healing of affected tissues greatly accelerated. It is recommended to have the patient seated comfortably with the affected arm resting on a table. Treat the lateral aspect of the patient's elbow, starting proximally from just above the elbow and moving distally towards the forearm. Target the lateral epicondyle and the wrist extensors. Treat the patient 2 to 3 times per week. Treatment protocols are customized by the Theralase TCL-2000 automatically based on a patient's physical characteristics. Pain will continue to decrease and mobility will continue to increase with each subsequent treatment.